Imagine your palms sweating, heart beating thump, thump, thump in your chest with a feeling that you might vomit at any moment. These are some symptoms that are experienced with anxiety. Anxiety is a mental disorder that many people live with on a daily basis. In fact, according to the Anxiety and Depression Association of America, anxiety disorders affect 18% of the American population. That is nearly 1 in 5 people who suffer from anxiety. Anxiety can be described as nervousness, fear, or excessive worrying. Luckily, this is a disorder that is very treatable. Some anxiety disorders include disorders such as general anxiety disorder, panic disorder, phobia, obsessive compulsive disorder, post-traumatic stress disorder, and separation anxiety disorder. Several different elements play a role in the causes of anxiety disorders. These can include things such as genetics, brain chemistry, personality types, and significant life events. It is normal to experience some anxiety in moderation when dealing with events in life. However, when anxiety begins to interfere with everyday activities, the person is probably suffering from an anxiety disorder that needs intervention. Anxiety disorders are diagnosed when the person has experienced symptoms for at least 6 months and has these symptoms for the majority of the time. Anxiety is something that can negatively affect someone's ability to perform adequately at home, work, and or school. Symptoms of anxiety also depend on what type of anxiety the person is actually experiencing. Along with these symptoms previously mentioned, a person can also experience symptoms such as recurring nightmares, overwhelming feelings of panic, muscle tension, episodes of trembling or shaking, dizziness, and a variety of others. Although treatment for anxiety disorders are readily available and anxiety disorders are relatively easy to treat, approximately only 1/3 of those diagnosed are actually receiving treatment. Those who are diagnosed with anxiety disorders are also more likely to see a physician because anxiety disorders have symptoms that mock physical disorders. Treatment often includes a mixture of therapy that includes medication and alternative methods. Treatment is also usually very individualized per patient depending on circumstances and the disorder or disorders that the patient has actually been diagnosed with. Outside factors can also play a part in the type of treatment that a patient receives, especially in cases where substance abuse or other existing health problems are present. Different types of behavioral options are available for those who experience anxiety disorders. Cognitive therapy is an effective and long-lasting treatment. This therapy identifies thinking and behavioral problems and focuses on ways to change the patient in order to deal with their anxiety. The patient is very involved in this type of therapy and a lot of planning takes place. Exposure therapy is used to reduce the anxiety response to the situation or object that causes the anxiety. This is done by gradually exposing the patient to whatever the stimulant is so the patient learns to be less sensitive to it. Exposure therapy has been found to be beneficial in cases of people with obsessive compulsive disorder and or phobias. Acceptance and commitment therapy is another useful type of therapy. This therapy teaches commitment and behavioral change. This is done so the patient is able to better deal with his or her thoughts during their feelings whenever they're having anxiety. Therapy is usually effective, but on occasion it's also necessary for it to be paired with medication. 1 in 10 people take medication to help control their anxiety disorder. There are 4 major drug classes that are used most frequently when treating anxiety. Selective serotonin reuptake inhibitors are a type of medication that blocks the reuptake of serotonin. Through this process, more serotonin is available to be used, which improves the patient's mood. Another type of medication that is used is serotonin norepinephrine reuptake inhibitors. With this medication, serotonin is also made readily available, but norepinephrine is made available in the same way to help reduce the patient's anxiety. Benzodiazepines are used for shorter-term management of anxiety. This drug promotes relaxation by reducing the physical symptoms and the anxiety temporarily. Tricyclic antidepressants are usually used when benzodiazepines are being needed more frequently. Since tricyclic antidepressants are more effective for long-term management, they are more favorable whenever short-acting medication is no longer, you need more than that. The exact cause of anxiety disorders is unknown. There is a stigma associated with most anxiety disorders where a person is perceived weak or could change their feelings themselves. Research shows that this is not the case. Environmental stressors and changes in the brain have been linked to anxiety disorders. It has also been found that they can be inherited from one or both of the person's parents, just like any other genetically inherited disease. Traumatic events or situations are enough to cause symptoms of anxiety disorder to emerge, but it is most likely in someone who is already predispositioned to the anxiety disorder in the first place. Statistically, some of us in this room will probably have or will experience anxiety at some point in our lifetime. Hopefully each one of us is aware so the resources available that we would be one of the 1/3 that's actually diagnosed who receive treatment when it's necessary. Being educated about anxiety disorders is an important part of being able to recognize symptoms. There are many different options for people to utilize to treat anxiety disorders. Anxiety can be a normal process, but it's important to realize that it can take over normal everyday activities. With the proper treatment, anxiety is completely manageable and should be treated like any other disease. It's a medical condition and should be treated just like a person would be treated who had high blood pressure or cancer. Experiencing anxiety can be a scary time, but experiencing anxiety can be a scary time, but knowing what to do and how to get help can give a person one less thing to worry about. So that's it. There's all my resources.